Propranolol is a beta blocker, sir.
Yes, it's a beta blocker, yes. Then few questions follows now.
Yes, sir.
What are the questions on this?
What are
What
the
are the different
different
types or classes of
selective and non-selective beta blockers?
the side? What is selective, what is non-selective?
Uh,
Okay. What are the indications for commonly for giving this drug?
Propranolol is given for hypertension, sir. Then essential tremors, GI bleeding prophylaxis. Uh, then for migraine we give. Um, um,
Any contraindications?
if the patient has bradycardia or any conduction defects
Good.
or bronchoconstriction, I
Bronchospasm.
mean, bronchospasm as in COPD, asthma.
What are the
Um,
common side effects you encounter?
mm, um, so one is bradycardia. Uh,
Okay. What are the manifestations of overdose?
Again, pulse rate can go down. Um,
And how do you treat the overdose?
not sure, sir.
Okay. So beta blockers, common indications, commonly following acute myocardial infarction. You give this drug and it's a protection for next 1.5 to 2 years.
Okay.
So commercially you give for all anterior infarctions. Systemic hypertension is commonly given and other drugs fail. And also in portal hypertension, as you rightly said. And in arrhythmias, you give atrial fibrillation arrhythmia to control the rate. And for supraventricular arrhythmias also you may give.
Okay.
Stable heart failure is a condition where you commonly give beta blocker. What are the beta blockers given in heart failure?
Uh, Sir, Cardiovas, beta plus
Bisoprolol,
carvedilol, carvedilol.
carvedilol. Okay, very good. So stable heart failure means when the edema is subsided,
Yes,
the
sir.
fluid overload is decreased. At that time you can give.
Yes.
Thyrotoxicosis indication when early
Mm,
part of treatment of thyrotoxicosis, where the manifestations are mainly tachycardia and tremor and palpitation. To control it
okay.
till the
Okay.
antithyroid drugs take effect. The time they start acting, you can slowly withdraw the beta blocker. Migraine, you rightly said, is also benign essential tremor. Anxiety related symptoms sometimes we give. And
Okay.
all the contraindications you rightly said. And it can impair your cardiac diabetes status,
Yes, sir.
your conversion, your psoriasis, to myasthenia. So you have to be careful when you give this drug, but they are very, very effective drugs. Now, how do you classify beta blockers? So those with intrinsic symptomatic activity and without intrinsic symptomatic activity. What is it by intrinsic symptomatic activity?
Not sure, sir.
So partial agonistic activity represents the capacity of beta blockers to stimulate as well as to block adrenergic receptors. So they will not produce much bradycardia compared to other drugs. Oxyprolol, pindolol, acetylprolol, celiprolol all belong to this group of drugs. And
Okay.
there can be another classification based upon the solubility, water soluble and lipid soluble.
Okay.
Atenolol, celiprolol, nadolol, and sotalol are the most water soluble. So they will not enter the brain, crossing blood-brain barrier. So common side effects on the nervous system like depression, nightmares, dreams will also be less when you give these water soluble drugs. But water soluble beta blockers are excreted by kidney. So in renal disease,
Okay.
you have to modify the dose. Now there are very short acting beta blockers and long acting beta blockers. Propranolol is a
Long acting.
medium one.
Okay,
Can you
sir.
name one long acting one? Atenolol, which can be given
Okay.
once a day. What is the
Okay.
shortest acting beta blocker, which can be given intravenously? Any
No idea, sir.
short acting drug, this can be given, especially in there is a uh, patient like pheochromocytoma and all. Short-term treatment of supraventricular tachycardia. We can give intravenous. Esmolol,
Esmeralda.
esmolol,
Okay, sir.
esmolol. And you said the
Esmeralda.
cardioselective beta blockers and non-cardioselective beta blockers. And there's some group of drugs with the alpha blocking effect. What are they?
Yeah. Alpha plus beta.
Pardon?
Not sure, sir.
So,
Good.
they will not produce vasospasm. So, common side effect of beta blocker, namely precipitation of claudication, venous insufficiency, they can be combated by giving labetalol. It has got both alpha blocking and beta blocking effect.
Okay.
Beta blocker overdose effect is on the heart, bradycardia, hypertension, heart failure, and syndrome.
So,
Basically, you have to stop the drug. And you may
okay,
take
sir.
atropine for bradycardia. And if it is not effective, intravenous glucagon is a drug of choice. 50 to 150 milligram followed by infusion. Glucagon has got a positive inotropic effect on the heart, raising cyclic AMP levels, whereas beta blocker has got negative inotropic effect. Also, beta blockers decreases the renal vaso resistance, and if everything is not working, then only option is to temporarily pace the heart and sort it out. Okay.
Okay. So, this is a X-ray lateral view showing an opacity in the middle zone, sir.
You mean this one?
No, sir. Above.
This one?
Yes, sir.
Okay.
Yes, sir.
What do you think it is?
It's a kind of fibrosis, sir.
Okay. This is actually the hilum of this patient. Hilum of this patient. Incidentally, you can see that there are a lot of osteophytes here.
Okay.
Can you see?
Yes, sir. Yes, sir.
There is a lot of osteophytes, and these are all calcified cartilages in an old person, postchondral junctions and so on. You can see this?
Yes, sir. Yes, sir.
Okay. And what about this one? This is the abdomen, no?
Gallbladder calculi.
Yes. Can this be pancreatic calculi or renal calculi?
Okay, sir.
Can it be?
The anatomical location seems to be
What location you get for pancreatic calculi? What location you get for renal calculi?
can be usually in the pelvic ileal system, sir.
So this is the gallstone in front of the vertebra.
Okay. Okay, sir.
Actually, there are two. One is here.
Yes, sir.
One
Yes,
is
sir.
here. If it is kidney, it is usually the gutter. No,
Yes, sir.
it has to be somewhere here.
Okay, sir.
And pancreas is situated here, just in front of vertebra.
Okay, sir.
It is lying on the vertebra, so it has to be here.
Okay, sir.
And kidney has to be here, and
Okay, sir.
gallstones.
Okay, sir.
Now, what is the role of physician in the treatment of gallstones? Do we have any medical treatment?
Um, so for biliorectal facilitation, we can give ursodeoxycholic acid.
Yes. So these days everything is done by laparoscopy. You do the cholecystectomy very easily. You do, and this stone is actually calcified stone. Calcified stones, this ursodeoxycholic acid does not work. So indication for giving ursodeoxycholic acid or medical treatment is the stone is very small,
Okay.
very few in number, and which is not calcified,
Okay, sir.
provided the gallbladder function is unimpaired
Okay.
and symptoms are very mild.
Okay,
Otherwise,
sir.
we have to go for surgical treatment.
Surgical. Okay, sir.
What are the different types of these gallstones? Different
Uh,
types. Pigment stones and cholesterol stones.
okay.